Hi, I'm Dr. Bethany Valachi, and I'm here to share with you a special Lunch and Learn team building event brought to you in part by a special grant by Crest and Oral-B. The pandemic has taken a physical, emotional, and financial toll on dental professionals' health. More patients are now returning for treatment. While some team members may be leaving the practice, heavy PPE is still required and elevated safety protocols are still in place. These, on top of the ergonomic challenges of dentistry, can lead to increased physical pain and emotional stress. Before the pandemic, team members were already experiencing work-related pain. Dentists reporting pain in the low back, neck, and shoulder. Hygienists, the highest incidence of neck and shoulder pain. And assistants, low back pain. Since the pandemic started, team members began to report additional symptoms, things like headaches, mental fatigue, dehydration, and elevated levels of physical exhaustion. In the operatory, team members are faced with specific risk factors. You have prolonged static postures, mental stress, non-neutral postures, visual challenges, repetitive motions, and force. Since the introduction of the COVID pandemic, team members are beginning to have to deal with additional risk factors. Heavy PPE, physical exhaustion, the financial impact of lost workdays from COVID, dehydration, retaining team members who may be wanting to leave the practice due to this pandemic, elevated safety protocols, physical discomfort and pain from all the heavy PPE, increased emotional stress. In addition to these risk factors, we now have many more people returning for dental care since the pandemic restrictions have been lifted. When we're addressing work-related pain in dentistry, we have to look at 5 specific areas: dental ergonomics, stress management, myofascial pain, stretching, and strengthening. In this short team member building video, we're going to look at 2 of these: stress management and chairside stretching. We know that dentistry is a stressful occupation. Studies tell us that dentists experience higher stress and lower well-being than the general population. In 2015, the ADA did a well-being survey where they asked dentists what their perceived stress level was at work. And it's no surprise that about 2/3 of dentists stated that they experienced moderate stress at work. However, what's more interesting is when they asked about severe pain associated with that moderate stress. And we see that 2/3 of the dentists or so reported that they experienced pain with their stress. So this connection of pain and stress is very real. So where does stress live? Studies tell us that the most prevalent areas for stress to manifest are in the neck and the low back. So there are many strategies for managing and reducing stress, but today I'm going to be talking about 3 strategies that are specific to dentistry and specific to the impact that COVID-19 has had on dental professionals' health. And that is corrective breathing, cognitive reappraisals, and communication. So if you remember back in your college days, you had this concept called the Bohr effect. And the Bohr effect taught you that a certain element stimulates humans to breathe. And if you remember, it's the carbon dioxide, right? And hemoglobin releases that oxygen to the body only at high blood levels of carbon dioxide. This is important because it directly is the process that's involved with heavy PPE and the resultant symptoms that team members are experiencing from this. So when you had to start wearing that N95 mask, some of you were probably asking yourselves, am I feeling all these tired, dizzy, dehydrated symptoms Because I'm rebreathing CO2. Well, that's part of it, because when you are rebreathing CO2 with a heavy mask, your blood CO2 goes up to 2 or 3%. Without a mask, it's 0.04%. So it definitely is elevated. So remember now, the elevated CO2 levels stimulate breathing. So you breathe more, you start to feel an oxygen hunger, you increase your rate of breathing, you increase your effort of breathing, and this leads to a carbon dioxide deficit as you're hyperventilating. It's similar to hyperventilating. You're also probably mouth breathing at this point. And this is the cascade of events that finally leads to these symptoms we've been seeing since the beginning of the pandemic. The dizziness, the sweating, physical exhaustion, headaches, shortness of breath, mental fatigue, and dry mouth. So I'd like you to join me doing a little self-awareness test here. So place one hand on your chest and one on your belly, and I want you to monitor which hand is moving more, okay? So I want you just to close your eyes and just breathe normally, and I want you to think about the first time that you heard that the COVID had become a pandemic and what that meant for you, that you weren't going to be able to return to work. Keep breathing. Which hand is moving more? Now you're realizing the impact that's going to have on your finances. Okay, keep breathing. Think about it. Which hand is moving more? The chest hand or the belly hand? If you're like most people, the chest hand will be moving more because that is your stress reaction. In addition, if your chest was moving more, you probably are more a mouth breather when you're stressed. And if your belly is moving more, you're probably more a nose breather. The differences between chest and abdominal breathing are very dramatic. Chest, shallow or stress type breathing results from slouched posture in the operatory and also emotional stress. It weakens your core muscles, but it increases the carbon dioxide in your bloodstream, which again elevates that breathing rate, and it triggers the stress response. On the other hand, abdominal breathing is normal when you're sleeping. It strengthens your core muscles, improves your posture, but an increased oxygen level that you get with abdominal breathing actually it elicits the relaxation response in your body, which is huge. This is really important because this means you're in charge. You can elicit this relaxation response whenever you need to. So nose versus mouth breathing, why is it important? When you breathe through your nose, you know it filters, warms, and humidifies the inhaled air. But since the introduction of COVID, the fact that it produces nitric oxide in the airway is very important because we know that this may have antiviral properties that can defend against COVID. Mouth breathing, on the other hand, causes 42% more water loss compared to nose breathing. And it can lead to dehydration, thirst, and overheating. So is nose breathing the answer to all of these symptoms caused by the COVID pandemic? It'd be pretty cool if it was, right? Unfortunately, it's not the answer entirely. It's how you breathe that matters. So, stress breathing is a fast type of breathing, about 20 breaths per minute. When people are stressed, they sigh more often. So that is also an important thing to monitor. Stress breathing is where people breathe through the mouth. It's more noticeable. You might see the shoulders go up and down when people are breathing. It's shallow breathing, and you usually can see people's chest go up and down when they're stress breathing. On the other hand, relaxed breathing is slower, We can slow our breathing down to 6 beats per minute and get very dramatic results. There's no sighing in relaxed breathing. Relaxed breathing is through the nose. It's very soft. It's deep and abdominal. So I'm going to walk you through this breathing exercise that will help decrease your carbon dioxide sensitivity when you're wearing these heavy N95 masks. So what I want you to do is place a hand over your abdomen. And then what we're going to do is divide the lungs up into 4 sections. And we're going to start with the bottom and fill a quarter at a time. When you breathe in, I want you to think slow, soft, and deep. And when I say soft, I want you to think about breathing in so soft and so slow that you can't even hear yourself breathing in. All right, here we go. So every time we breathe in and fill a quarter of the lungs, you're going to hold it for 4 counts. So here we go. So breathe in, 1, 2, 3, 4. Fill the next quarter, 2, 3, 4. Soft and slow, 2, 3, 4, and all the way inhaled, 2, 3, 4, and exhale, 2, 3, 4, and exhale another quarter of the lungs, 3, 4, another quarter, soft, soft, deep. So practice this exercise often. And it's so important to be thinking about the breathing qualities of soft and slow and deep. Now there's another cognitive exercise I want to share with you, and this is positive cognitive reappraisals. This is one that I've been doing a lot since the COVID pandemic, and this is where you stop and recognize a negative thought pattern that's going on in your mind before it starts spiraling out of control. So I think this is important because I think a lot of us have a lot of these negative thought patterns, and rightly so, since this COVID pandemic. So the first thing you're going to do is stop and recognize that negative thought that you're having. This is one of the hardest things to do because just being mindful and recognizing it is one of the hardest parts. So stop, recognize it, and this stops the negative thought pattern in its tracks. Now, you're going to take 3 deep abdominal breaths like we just learned. Soft and deep. In through the nose, slow. Soft and deep. And now you're going to reflect and ask yourself a question. Ask yourself, did I let my thought patterns spiral out of control? Or is there a better way to look at the situation than what I was just thinking? And then you're going to choose which way you're going to react to that negative thought pattern. So studies show that the relationship with low back pain and stress is quite specific. It's not just generalized stress that causes low back pain, but very specific types of stress like poor communication, low workplace social support, job dissatisfaction, family conflict, and economic insecurity, which has really been a problem for many people during this pandemic. So let's talk about one of these more in depth, poor communication, because this can impact the entire team. Poor communication actually causes stress. So one thing that we can do is to monitor your tone of voice. These can be kind of challenging sometimes because our normal tone of voice can be perceived as not normal or angry to others. So really being mindful of your tone of voice in the workplace. Eliminating phrases starting with you. So rather rephrase this like I heard you say, or I understood you to say this. Starting with the word you puts people on the defensive and can really elevate emotions. Don't assume. Don't try to figure out what other people need. Rather, just ask them what they need. Very oftentimes when we assume it, we don't get it right. Sometimes now may not be the best time to talk about something. So ask the person, you know, if now is not a good time, maybe we can revisit this later. Remember, good communication with your patients is just as important as good communication with your team. So in our 5 steps to practicing dentistry pain-free, the other step we're going to talk about here is chairside stretching. Chairside stretching is the only technique that I teach in my online video courses that addresses every single one of the etiologies of myofascial pain and dysfunction. So it addresses muscle imbalance, muscle ischemia, disc degeneration, and an upregulated sympathetic nervous system. Tight muscles need to be targeted with very specific stretches. We want to be stretching muscles that tend to be tight and short and ischemic, not ones that are elongated and weak. These need to be able to be performed chairside, and they need to be done frequently. Studies show that shorter duration stretches done more frequently is more effective than longer stretch breaks done less frequently. For instance, a 10-second stretch break done every 45 to 60 minutes is more effective than a 2-minute stretch break done every 2 hours. So let's talk about how to stretch safely. This is not how. So we're going to move into and out of a stretch slowly. Moving into a stretch too quickly can cause micro-tearing of the tissue. Assume the starting position and then breathe in and exhale as you increase the stretch up to a point of mild tension or discomfort, never going into the pain. You hold the stretch 2 to 4 breathing cycles and then repeat it. You can repeat the stretch for symptomatic areas up to 3 to 5 times a day. And you, again, never stretch in a painful range. So the first stretch I'm going to share with you today is called the untwister. It's a stretch that I developed based on 2 dental studies. And this is great for low back pain resulting from repeatedly twisting in one direction, perhaps toward a delivery system or such. So it starts with leaning the left elbow on the left knee. All your weight should be going through that left elbow, looking up towards the ceiling, and then raising the arm overhead. And you should be looking up toward the ceiling here. And remember to count by breath cycles. We're counting 2 to 4 breath cycles. This helps to address the muscle ischemia and also helps with the relaxation response. Okay, now let's see if you're tighter on one side than the other. So rest your right knee, your right elbow on your right knee, and look up to the ceiling through your left elbow. Keep breathing, 2 to 4 breath cycles. Observe if you're tighter on one side than the other. Okay, now if you're tighter on one side than the other, you should be performing this primarily toward the tight side during the workday. So as we go through the stretches, observe which side you're tighter on, because you'll want to be performing the stretches primarily toward the tightest side during the workday. The scalene stretch is a very important one for team members. The scalene muscles bend the neck to one side, and they get very tight during the day when you're looking into the oral cavity and have to side bend or crane the neck to view the oral cavity. So I'm going to show you this two ways. One way is if you have gloves on, so you're putting the right hand behind the back, the left gloved hand at your side, and then you're bringing the left ear to the left shoulder. So your nose is looking straight ahead. And again, breathe deeply, 2 to 4 breath cycles. So you're still keeping your gloves clean, or you're not contaminating them. Now the second part of the stretch is you're going to tilt the chin slightly back. And this gets the anterior scalenes and sternocleidomastoids, which get very tight during the workday. So this is a very important second part to this scalene stretch. Again, hold it there, 2 to 4 breath cycles. Tightness in this anterior scalene area, this can also cause brachial plexus tightness, which can lead to thoracic outlet syndrome, which can cause paresthesias and numbness and pain into the arm. Now, let's try this on the other side. Except this time I'm going to show you how to use your hands. Put one hand under the edge of your chair, the other on your head, and you're going to just bring your right ear to your right shoulder. So you're just using your arm weight to get the stretch. You're not pulling on your head, just using the arm weight. Now, part 2 to this 3 stretch sequence is the trapezius stretch. This is ear to armpit. You're going to start the same way with the right hand behind the back, left gloved hand resting on your leg, and now you're going to bring the left ear to the left armpit. So you're going to get a stretch. Now you'll feel it up here in your upper trapezius muscles. This is a very large muscle, so bring the head further forward, kind of experiment here, side bend it, rotate it more to see what part of that very large muscle is tightest. Keep breathing, 2 to 4 breath cycles. Okay, now you're going to do this on the other side, but let's use hands this time. So bring the right hand to the head and left hand under the seat of your chair. And now you're going to bring right ear to right armpit. Your eyes are going to be looking down toward the floor. And again, you can feel what a better stretch you can get with your hands assisting this stretch. So the levator stretch is the third stretch in our 3 stretch neck sequence. And you'll start the same way as you did with the others, with the right hand behind your back. This time you're going to bring your chin to your armpit. So chin is now going to go to the left armpit, and you should feel this in the right neck. And those are the levator scapula muscles, which get very tight when you're looking down into the oral cavity or when you're wearing loops that have a very poor declination angle and are causing you to look down. So there are a lot of non-ergonomic scopes on the market that actually can make neck pain worse. Okay, now let's do this with hands on the other side. So anchor one hand under your chair, hand on the head. This time nose is going into armpit. Deep breaths in and out, 2 to 4 breath cycles. The thoracic stretch is an important reversal stretch for dentistry because we very oftentimes are leaning forward. So this reverses the thoracic curve. So hands behind the head, and you are spreading the elbows wide, looking up toward the ceiling, and arching the upper back. So it's a really nice reversal, kind of a micro mobilization for your upper back. Keep breathing, 2 to 4 breath cycles. So you'll find a chairside stretching chart that you can download with this Lunch and Learn session. I teach 20 chairside stretches, which are all available on my website. Now, when you're thinking, when would I possibly have time to do these chairside stretches? I guarantee you, you have time. Everyone has time. For the dentist, while the assistant is light curing during a failed or missed appointment, while the assistant is making an impression. For hygienists, while the patient is having a fluoride treatment before you reach for instruments, or during a Casey presentation, or while you're waiting for anesthesia. Assistants, you can stretch when the doctor's away doing a recall exam, or maybe when they're doing patient education on a procedure, or when they're sculpting a composite or carving an amalgam. Many opportunities here to do this. Thank you for joining me for this ADA Lunch and Learn event. I hope you found the education valuable. There's many more resources on my website at posturedonics.com. Thanks for joining me, and practice in good health.